Hello everyone, in this video we are going to talk about ECG, that's electrocardiogram, and the leads that are used in the ECG. So before beginning this video, I would please ask you all to subscribe to my channel if you haven't done so. Okay, let's start this video. Now, what is ECG? What does it do? ECG basically measures the electrical activity of the heart. Now, ECG measures the electrical activity of the heart using the leads. Now, there are total of 12 leads used in the ECG, placed on different parts of the body. Now, what actually happens is in the ECG is that when our heart, that is the myocardium, produces some electrical signals. Now, these electrical signals are transferred to the rest of our body, and when we put the ECG leads on the skin of the body part of these body parts, this ECG lead actually picks up the electrical activity from the heart, and then it displays it on the graph. So basically, ECG is nothing but a graphical representation of electrical activity of our heart. Nice, isn't it? Okay, cool. Now let's talk about the 12 leads that we use in the ECG. I'm sorry about the previous message. Anyways, now let's talk about the 12 leads that are used in the ECG. Beginning with the first one, that is the bipolar leads. Now, these are 3 leads. Bipolar means these leads will have both positive and negative potentials. Okay, now these leads involve lead 1, lead 2, and lead 3. So these are leads 1, 2, and 3. These leads are placed on the right hand, the left hand, and the left foot of the body. And basically, they measure the potential difference between these. So these are bipolar limb leads. Okay, so again, bipolar limb leads are include leads 1, 2, and 3, and these are placed on right hand, and left foot. The second ones are unipolar leads. When we talk about unipolar leads, these are placed on 2 parts of the body, that is on the chest and also on the limbs. Now, the ones on the limbs are known as AVR, AVL, and AVF. And the ones that are placed on the chest, these are V1 to V6. Okay, now what is important for us to know is also the location of the chest unipolar ECG leads. So V1 is placed on the 4th intercostal space, palpating the 4th intercostal space, opposite to the place where normally the heart is located, that is right side of the sternum. Now, V2 is also located on the 4th intercostal space, but this one is placed just left to the sternal border. V3 is left alone. First we place V4, which is located on the 5th intercostal space. Now we are going to start from the mid-clavicular line, that is 5th intercostal space on the mid-clavicular line. V5 is located on the fifth intercostal space. Now let's go more lateral, that is anterior axillary line. And again V6 also fifth intercostal space, but this time it is mid axillary line. V3 will left, V3 will be placed in between V2 and V4. So this is the position of the chest leads. Okay, so these are all the leads that are used in the ECG. Let's revise it. So ECG basically measures the electrical activity of the heart. Okay, now ECG is measured using, ECG is actually a graphical representation of the electrical activity of the heart, and it is measured using 12 leads. These 12 leads include bipolar limb leads, which are given by leads 1, 2, and 3, placed on right and left hand and left foot, which is not important in terms of examinations. Unipolar leads include the limb leads. These are ADR, ADL, and ADF, and the chest leads. These are V1 to V6. Why are the placement and the leads important? Because by these leads we are going to determine the location of lesion in the heart. So that's all for today's video. Thank you for watching. I'll see you in the next one.